But the problem is that I don't have the patient, the way our system works, right? I don't have the patient volume. I don't have the number of patients coming through the door every day to actually support that doctor's salary. So basically, I'm running in the red from day one, right? I'm just constantly losing, and trying to make up that money through other means. I'm trying to levy taxes on my county or whatever it is I'm trying to do, right, to try to make up that deficit. Virtual comes along and says, well, wait a minute. You have your 5 hospitals. Collectively, you'd have as much volume in a day as maybe one larger hospital, maybe one, right? So why don't we have one virtual doctor serve all 5 hospitals simultaneously, because they can use the virtual technology to be in all the different places when they need to be. Each of you pays just 1/5 of the cost of what that doctor would normally cost you, rather than 100%, right? Your patients get the same care. You pay a fraction of the price that you would otherwise have to pay. All right, and then an added benefit is because you're not constantly trying to find someone to move out to your place or to fly out to your place to work locum tenens, that doctor that has a relationship or forms a relationship with your patients and your staff and your community can work for you, for the duration of their career potentially if they wanted to, because it doesn't matter where they live, whether they live in your community or they live somewhere else, it doesn't matter. They're always available to you at the times you've asked them to be available, and yet they cost you a fraction of what it would otherwise cost to have somebody there. That's a huge game changer when we see all of our rural hospitals going bankrupt and all these kinds of things happening. That's another potentially transformative element, right? The fact that I can respond to your messages by text, or I could, we could do a quick video call or something like that. Again, from the perspective of running a medical office, right, could decrease my cost, could decrease my carrying cost in certain ways, right? I may not need, if I'm serving patients virtually, I may not need a 35,000 square foot building to service patients virtually, right? I may be able to sit in a much smaller place and do the same thing. So if I don't have all that rent or all that maintenance or whatever to carry, maybe I can pass that back to my patients in the form of savings on what it costs to actually see. So, but I would add kind of the final question on that, and the reason the jury's out on this a little bit is because all the things I've cited, and there are many, many more that I'm sure others could contribute to this, the limitation that we have seen so far is not the human imagination. It's not the ability of doctors or patients to imagine how we could use virtual technology to make care better. There are all kinds of things going on in that area, and I would add to that medical technologists who are just developing different kinds of cool tools all over the world, and you can plug this thing into that, and there's all kinds of things you can do like this. But the barriers that we have faced historically up to this point have been primarily regulatory and then insurance-based. The insurance company says, I really don't want to pay for this kind of activity for various reasons. My intent here is not just to sort of villainize the insurance companies for that reason. They have reasons for why they feel the way they do, and there are people that are abusing some of the aspects of that, of what virtual enables you to do. But there are structures that we could put in place to correct for some of those things, right? So what's needed here, or the brake that's on it right now, exists at the insurance level and at the regulatory level. We need some of these things that are entirely artificial, right? They were created for a reason. Sometimes those reasons are still valid. Sometimes, frankly, they're not. But those things need to be modified, revised, in some cases completely erased. And so from our perspective, the biggest push needs to be to begin to have those conversations, to identify where the blockages and the barriers are, and then begin to talk about this is not a black and white, right and wrong situation, right? You as the regulator, you as the insurance company, you have your concerns. These concerns have some validity, right? We as the frontline care provider trying to care for our patients, this is what we're seeing, right? Maybe we can get in a room and talk about these things, maybe a virtual room, right? And talk about these things and come up with an accommodation that serves the needs of both entities adequately, while still bearing in mind what are we all here doing? We're all here supposed to be taking care of our patients and trying to offer the best care possible. So if we have a situation where we could offer our patients a higher quality service, but we aren't because your regulations have made that impossible, that's a conversation we should be having.